So the application of cold therapies or ice is something that has been utilized in the athletic training room for decades. And it's certainly something that remains a part of my practice, specifically for pain management. I feel like ice can be really helpful for somebody who is in a lot of pain. I know that there's different theories out there about why ice works or how it works or how it doesn't work. Tell me what the literature is saying about ice.
Well, it's a little bit controversial. You know, there are some people that are claiming that ice is not effective at restoring your function or decreasing your swelling after injury. And the truth is that there aren't a lot of head-to-head studies that can definitively prove that using ice is the best thing to do. So it's more of a lack of literature out there with this strong head-to-head research, which is difficult to do in a clinical setting, obviously. I definitely don't throw ice out with the bathwater, if you will, because I think that, as you said, the number one benefit of ice for us is going to be pain relief. It's one of those great time-tested things that we do to relieve pain. We use it for cryokinetics, you know, to relieve pain, to facilitate exercise, remember? So that's why ice is such a great thing. And it's really important that we don't just start bashing something just because there's a lack of evidence. If there was evidence in the other direction saying ice is harmful, then you wouldn't use it. But in clinical practice, the best evidence tells us still that ice is effective, it's great for reducing pain, and that until I'm proven otherwise, I'm going to continue using it in my practice.
It's such a huge part of the athletic training practice, and athletes are really in the habit of using it quite often.
Yep.
And as you state, there's really no evidence to say that this is a harmful thing to do. And so we're sort of justified continuing to use it, specifically, as I said, for my personal practice, from a form of pain relief and a form of pain management.
You know, one thing that I always need to reiterate with people, we forget all the time. Ice does have some harmful effects sometimes. You know, if we place it right over a nerve, you can get a nerve palsy, frostbite. All these things that we kind of take for granted, and saying it's such a great modality, but please, ice does have some disadvantages that we need to take care of, like not applying it directly over a nerve or for, you know, extended periods of time. So don't forget, ice is great. And it still has the benefits, but it's until we are proven otherwise, we're still going to use it.
Yeah, and that's like any modality we utilize, right? Every modality we use has a risk and a reward, just like medications have risk and rewards. And it's really about the clinician making an appropriate decision on how to utilize that modality with the patient that's in front of them or with the athlete that's in front of them, based on the athlete's needs.
Exactly.